Did you know that vaccines can reduce your child's risk of ear infections? Hi, I'm Dr. Scranton from Pediatrics Northwest. In partnership with the Tacoma-Pierce County Health Department, I would like to talk to you more about ear infections today. The key piece of information I would like you to take from this video is that many ear infections do not need to be treated with antibiotics. Your provider can determine what type of ear infection your child has and whether or not antibiotics are needed. Did you know that there are actually two types of middle ear infections? The first is called otitis media with effusion, or OME. OME is a buildup of fluid in the middle ear. This commonly happens after upper respiratory tract infections and can last for over 1 month. Other common causes of this fluid buildup include allergies, irritants such as cigarette smoke, drinking while lying on your back, or air pressure or change in elevation. You do not need antibiotics to treat an OME. Most of the time, it will go away on its own. The second type of middle ear infection is called acute otitis media, or AOM. This infection of the middle ear is often painful. It is often caused by bacteria. However, AOM may also be caused by viruses. The bacteria that usually cause AOM are Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. The viruses that most commonly cause AOM are respiratory syncytial virus, or RSV, rhinoviruses, the influenza, and adenoviruses. Acute otitis media may improve with antibiotics, but antibiotics are not always necessary because not all AOM are caused by bacteria. So how do you know if your child has an ear infection? Here are some common symptoms associated with an AOM. Pulling at the ears, especially with children, excessive crying, fluid draining from their ears, sleep disturbance or trouble sleeping, a fever, headache, problems with hearing, irritability, especially with infants and toddlers, and difficulty balancing. We recommend that your child see their healthcare provider if they have a temperature of 100.4 degrees Fahrenheit or higher, if they have discharge of blood or pus coming out of either of their ears, or if their symptoms have not improved or are worsening since their diagnosis of an ear infection. And remember, if your child is less than 3 months of age and has a fever, it's important that you contact your healthcare provider right away. How do we diagnose ear infections? Ear infections are diagnosed with a special instrument called an otoscope. This is used to look inside the ear at the eardrum. Your provider will look to see if there is fluid consistent with an OME or signs of an infection consistent with an AOM. If your provider sees symptoms of an AOM, they will decide if your child needs antibiotics based on your child's age, the illness severity, your child's immunization status, and options for follow-up. Based on that information, your provider may ask you to wait a few days before prescribing antibiotics to see if the ear infection will resolve on its own. When your healthcare professional diagnoses your child with an ear infection, ask them about the option of waiting before antibiotic treatment. Never pressure your healthcare professional for an antibiotic, and talk with your provider about vaccines that may help prevent ear infections in your child. Remember, when you use antibiotics appropriately, you do the best for your health, your family's health, and the health of those around you. Thank you for listening. I'm Dr. Scranton from Pediatrics Northwest.